Hi students, I am Dr. Mathew Jacob, Associate Professor from the Department of Oral Pathology, Vinayaga Mission Shankaracharya Dental College. Today's topic of presentation is on periodontal ligament. To begin with, what is periodontal ligament? So as you can see in this picture, periodontal ligament is the connective tissue that is in between the tooth and the alveolar bone. So as we can see, the tooth is embedded inside the socket, which is actually the alveolar bone, and the yellow component over there represents the periodontal ligament. A brief introduction on the periodontal ligament. So what we can see from here is that the periodontal ligament develops from the dental follicle. One of the functions of this periodontal ligament is that it provides collagen fibers from the synthetic cells, that is the fibroblasts, which help to anchor the tooth to the surrounding bone. So as I said again, I would like to repeat that one of the crucial structures of the periodontal ligament is to provide tooth support and stability while inside the oral cavity. There are different ways by which we can study the periodontal ligament. So there is the longitudinal section as well as the cross section. So in the coming slides, I will be showing a few of the schematic pictures which represents the tooth and its presence in the alveolar bone with the periodontal ligament surrounding it. So shall we move on? So here we see a tooth which is present inside the alveolar bone, which is represented as blue. So if we were to imagine the tooth directly attached to the bone, what would happen is, due to normal physiological functions such as mastication, chewing, speech, it can indirectly, the force can directly move across the long axis of the tooth and touch the bone, and the force is transferred to the bone. Thereby what we see is that there is a direct force transfer in long term can affect the function of the bone and reduce the capacity of the bone. So to prevent that, what we have is a soft tissue structure, that is the periodontal ligament between the tooth and the bone. So as we can see here, the yellow which I have marked here is the periodontal ligament, which is soft tissue between the tooth and the bone. And what I have marked over here is the gingival component, which I marked as red. So what we can see is that this is a longitudinal section of a tooth representing the periodontal ligament. Now here we can see the cross section of the same tooth. Now this is a single rooted tooth, so we can see the alveolar bone, we can see the periodontal ligament, and we can see the tooth. So this is how we can see it as a longitudinal section and a cross section. Moving forward, here I have shown the schematic picture of a cross sectional area with two single rooted tooth, and this is a decalcified section showing the different parts. As we move on, we can see the dentin, the cementum, and then the bone. So the focus over here is the periodontal ligament. There is a small gap over here. This is, in radiographically you will see it as a periodontal ligament space. Now those were all schematic representations. When we move on to actual periodontal ligament, we can appreciate it or study it in three different sections. We can see the specimen, the actual specimen. Here we have the mandible with a tooth, that is, this is the antesection of the mandible. Now here we can see the alveolar bone. We have two plates, the labial plate and the lingual plate, and inside we can see the pongiosa carrying the alveolar marrow, and we can see the tooth, and the space which you see here is where the periodontal ligament resides. This is a ground section, not of the same section but a different section, again to appreciate the tooth with a small portion of gingiva. Now when we go for a decalcified section, we can appreciate the soft tissue better. We can see the proper gingiva here in this area. We can see the soft tissue immediately beneath the gingiva, and we can see the alveolar bone. And this is the tooth. The space between this tooth and the alveolar bone is where the periodontal ligament resides. So moving on, there are different parts when you study the periodontal ligament. There are the cellular component, the blood vessels, the nerves which supply the periodontal ligament, and in today's PowerPoint, which I'll be focusing on the fibers. So what are the parts when we talk about the cellular components? There are various synthetic cells, defense cells, resorptive cells. So when we talk about the synthetic cells, we have the fibroblasts, osteoblasts, and cementoblasts. Now each of this contribute to each part of the periodontium. So we have the fibroblasts which deposit the collagen fibers, the osteoblasts which deposit the bone, the cementoblasts in the initial layers forming the cementum of the tooth. These help in maintaining and contributing to the repair of the periodontal ligament. Blood vessels, as we know, it is required for the nutrient exchange and healing. The nerve fibers help to transmit the sensory information along the tooth. Today's topic, we will be focusing on the fibers. There are two basic fibers. We have the principal fibers and the gingival fibers. Now when we talk about these fibers are mainly made up of collagen. Now this collagen is secreted from the synthetic cells which I mentioned before, that is the fibroblasts. So what are the types of collagen which you see? They are predominantly type 1 and type 3. Apart from that, we also have 5, 6, 12, 14, 61 and 124. The two types of fibers are the principal fibers and the gingival fibers. Moving on, we will talk about the principal fibers. So as we can see, they are named as alveolar crest fibers, horizontal fibers, oblique fibers, apical and interradicular. So alveolar crest fibers, they are named based on where they are located, that is in the cervical portion of the tooth, and it rests from the cervical portion of the tooth to the alveolar crest of the alveolar bone proper. The horizontal are named horizontal because of the direction. They are mainly perpendicular to the long axis of the tooth. So, and they are located in the mid root of the tooth to the alveolar bone proper. Oblique, again based on the direction, they are obliquely, they are directed obliquely. So they are located in the apical 1/3. The apical, as the name suggests, they are located in the apex of the tooth, and in interradicular they are located between the roots of multi-rooted teeth, not single-rooted teeth but multi-rooted teeth. So one thing we have to note is that the apical fibers are irregularly placed, while alveolar crest fibers are the fibers which are present in the tip of the alveolar crest. So moving on to the actual picture, a schematic picture we have on the left and the actual picture on the right. So we will move on to each fiber. The first set of fibers are the alveolar crest fibers. So to identify that, what we can see here is I have tried to draw the area of the alveolar crest. This is the bone and this is the crest of the bone. The bone is called as alveolar bone, so therefore alveolar crest group fibers. The fibers are located here, the first set of fibers. The next is the horizontal group, as I mentioned, as you can see here, based on the direction. They are perpendicular to the long axis of the tooth. They are perpendicular to the long axis of the tooth. The next set of fibers are the oblique fibers. Again, based on the direction, they are called as oblique. The next set of fibers are apical, group of fibers present in the apex of the tooth. And in case of multi-rooted teeth, we have the interradicular fibers. The last set of fibers, which we will see in the next gingival set of fibers, are transeptal fibers. Just to show you where they are located above the alveolar crest fibers, as you can see here. This is the alveolar crest group of fibers and they are located above it. Now transeptal, from the name itself, they move from one tooth to the adjacent tooth. These are the direction of the fibers, which I marked in yellow. Now moving on to the gingival fibers, there are mainly three sets of fibers which we must know. One is the transeptal, as I already told in the last slide. They are located in the cervical portion of the tooth and they attach from one tooth to another tooth in the cervical portion. They are basically needed to resist the tooth separation. Then we have three groups of fibers which I'll explain in the next slide. They are mainly to resist the gingival displacement. And the last group of fibers are circular fibers. They are band fibers which interlace in the gingival group. Now if you notice, all these fibers are located in the gingiva, so their primary function is to maintain the gingiva in a collar-like fashion in any dressing as we see, in a male dressing as we see. So if you were to appreciate here, the red represents the gingiva and this is where the gingival fibers are located. So we have covered the principal fibers. There is another set of fiber which are called as oxytalin fibers. Now if you look at this set of fibers, the direction is different. They too are made up of, they too have collagen. So if you see here, what do you see here is the direction is along the axial direction of the tooth. So they are attached predominantly from one blood vessel to another blood vessel and therefore help in the constriction and vasodilatation of the blood vessel. As you can see here, this is a representation of a tooth, the gingiva and periodontal ligament space having the periodontal fibers, the alveolar crest bone. Here I am going to talk about the fibers which are located in the gingiva. The first one is dentogingival, therefore dentogingival fibers. And as you can see, the direction is moving upwards. The next set of fibers, dentoperiosteum, so dentoperiosteal fibers. They move from the tooth to the periosteum. Next set of fibers, alveolo-gingival fibers. So they move from the alveolar crust to the gingiva. Now the next one which I said was circular fibers. Just to recap, the three group of fibers. And what we see here, if you observe carefully, are these round cross section of fibers. Now these are actually the circular group of fibers. They move around the tooth in the coronal portion. So if I were to draw it in a longitudinal section, they would move, as you can see here, around the cervical area of the tooth. This is, if you imagine this to be the cervical area, the circular fibers are in a circular motion around the tooth. Now I would like to just touch briefly on the development here. Now the reason for mentioning the development is, as you can see, the direction of the tooth is upwards or occlusally, that is, it moves from the bottom or inferior part of the mandible, or in case of the maxilla, it moves away towards the occlusal surface. So because of which, what happens is that when the periodontal ligament fibers are first formed, as you can see, they do not have any particular direction and the root has not formed. So the first set of fibers, as they develop, they move upwards more apically. And once the root has completely formed, the periodontal ligament fibers will readjust in this manner. To repeat, these fibers have not formed, are forming. As you can see, the direction is more oblique towards the alveolar crust. Then the first set of fibers form, and as they mature, again they reside the final position. Now moving on to the nerve supply. In the nerve supply of the tooth, we can see here that there are nerve fibers which move from the periapical region, which supply the whole tooth. Now these fibers, as they reach the apex of the tooth, they branch out and move into the periodontal ligament space, and these are actually nerve fibers which are in yellow, and they have nerve endings present in the periodontal ligament, which provides the stimulus for the sensory stimulus for the teeth. Therefore we are able to enjoy the food we have consumed. So just to give you one idea of how it is, I am showing a schematic representation of a mandible, the mandibular canal, the mandibular foramen for the opening for the entry of the mandibular branch of the trigeminal nerve. So it moves along the mandibular canal. For example, here is the anterior teeth. It moves into the apex. As it moves into the apex, it branches out laterally to supply the periodontal ligament. So today's topic I have taken on the principal fibers and the dentogingival fibers, which is an important question in your undergraduate dental program. So as you can see, I have explained about the different types of fibers which are present. When you answer the question, we must make sure that we draw the diagram, a schematic representation of the different fibers and the orientation of the fibers, and including the dentogingival group as well as the axial fibers, that is the occipitalan. Thank you.